Yeah. Good afternoon, everyone. I'm Mayor Paulette Guajardo. This week, we are very pleased to announce that Driscoll Children's Hospital and the City of Corpus Christi and the county are teaming up to care for our community. Our guests from the hospital will provide more details on the COVID-19 vaccine clinic in just a moment. But first, I want to introduce President and CEO of the Driscoll Health System, Eric Hammond, and Executive Vice President and Chief Operating Officer of the Driscoll Health System, Dr. Mary Dell Peterson. We are also joined today by our County Judge, Barbara Canales, and Public Health Director, Annette Rodriguez. I want to thank all of our guests for attending today and helping us provide this vital service to the community. We will now pause for a brief Spanish translation, and then we will hear from Eric Hammond, President and CEO of Driscoll Health Systems.
Esta semana nos complace anunciar que el Hospital Infantil de Driscoll, la ciudad de Corpus Christi y el condado se están uniendo para cuidar de nuestra comunidad. Nuestros invitados del Hospital Infantil brindarán más detalles sobre su clínica de vacunación en un momento. Pero primero quiero presentar al presidente y director ejecutivo del Sistema Hospitalario Driscoll, Eric Hammond, y el vicepresidente ejecutivo y director de operaciones del Sistema Driscoll, la doctora Mary Dell Peterson. También nos acompañan hoy la juez del condado, Bárbara Canales, y la directora del Distrito de Salud Pública, Annette Rodríguez. Quiero agradecer a todos nuestros invitados por asistir hoy y ayudarnos a brindar este servicio vital a la comunidad.
Thank you, Mayor. On behalf of Driscoll Health System, we're incredibly proud and honored to partner with the city and the county to vaccinate our most vulnerable 65-plus population with the COVID vaccine. Thank you for your leadership, Mayor, and thank you for your leadership, Judge. This 65-plus population is our great-grandparents, our grandparents, and parents. Just last week at Driscoll, we had a 70-year-old grandmother that says, I am ready to get this vaccine so that I can get back to playing with my grandbabies the way I used to. And then further what she said, which really surprised me, she says, over 50 years ago, I was a patient at this hospital. And so I was really excited to tell her that we're going to have a plan where she, as well as some of her colleagues, are going to be vaccinated. I'm also incredibly proud of the Driscoll team. Dr. Mary Dell Peterson and the entire team has been working with the local and state officials to make this happen. And they've done a phenomenal job of working with those team members. Working together, our teams and our community, we're going to improve the health of this community, and that's going to absolutely save lives. So on behalf of Driscoll, we thank you for working with us. At this time, I'd like to introduce my partner at Driscoll, Dr. Mary Dell Peterson, who's our Executive Vice President and Chief Operating Officer that's been working tirelessly to make this happen. Dr. Peterson.
El Sistema de Salud Driscoll se enorgullece en asociarse con la ciudad de Corpus Christi para ayudar a los más vulnerables de nuestra comunidad, la población de más de 65 años, para así recibir la vacuna contra el COVID-19. Como Sistema de Salud Infantil, sabemos que las personas de la población de más de 65 años son ahora abuelos y bisabuelos de nuestros pacientes de Driscoll y pueden haber sido niños y haber ido al Hospital Driscoll. Estoy muy orgulloso de todos los miembros de nuestro equipo dedicado a Driscoll que han trabajado diligentemente para ayudar a poner en marcha este megasitio de la vacuna COVID. Quiero agradecer a todos los oficiales por su trabajo. Le pido a todos que tengan paciencia. Ahora los comentarios de la doctora Peterson.
Thank you very much. So I'm Dr. Mary Dell Peterson. I want to thank Eric and obviously the Driscoll board, the mayor, the judge, Annette, for all of her tireless work in helping us put this together. My job is really to educate you and walk through the logistics of how this is going to work. And so it's very important for this to work well for you all to listen and really pay attention to the directions that I will be giving you. First of all, It's only available to individuals who are 65 and older, okay? And it's by appointment only. Please do not show up if you do not have an appointment. You will be turned away, all right? It's really important. So how do you make an appointment? You will need to go to our website, driscollchildrens.org/COVID-19 vaccine. I'm going to say that again. driscollchildrens.org/COVID-19 vaccine. From there, you will be able to get an appointment. Now, how many appointments will we have? Well, we requested 2,000 from the state this week. We got 1,000. So that's how many appointments will be available for this week. We will continue to request more from the state, and as they give us more, we will create more appointments each week. The other way that you can also get an appointment, because I know I've got a couple of 86-year-olds living with me. I know that not everybody has a computer. Not everybody can even use a smartphone. I understand that. So we have set up a call center from our Driscoll Children's Health Plan, and we have bilingual people as well. And so I'm going to give you that phone number. It's 1-844-977-1477. They will be available Monday through Friday between 8 and 5 p.m. So that's two ways that you can get an appointment. You can go to our website or you can call. Now, I expect everybody will be calling, so I'm sure the phones will be very busy. So I would ask for those that have a computer or a smartphone to use that modality first so that we save the call lines for people that don't have that. So what vaccine will we be getting? Well, you know that there's two that have been authorized so far, Pfizer and Moderna. We've been giving both out at Driscoll. This week, we have Pfizer. Every week, I don't know which one I'm going to get, but we can, administer either one. The clinic that we're going to have is going to be at the American Bank Convention Center. We really appreciate the Convention Center offering its facilities to us. It's going to happen this Thursday from 9 a.m. until 11:30 a.m. I'm going to tell you one more really important thing. Do not show up too early. You will be turned away. How early is too early? More than 30 minutes before your appointment. We do not want to create traffic jams. I promise you we will get you in and out. If you're a few minutes late, don't worry about it. I know if you're like my husband, you like to show up to everything really early, but you do not have to show up that early, I promise you. Please, for traffic control, show up around the time of your appointment. So all of our mega sites every week, if we get vaccine, will be in the same place at the American Bank Center. On our website, it shows you where to park. Basically, it's going to be on the bay side of the American Bank Center, and there'll be parking at the barge dock. There'll also be parking along the curve for handicap. We will have people to assist those that need wheelchairs or assistance getting into the building. So we do have that all planned for. So I'm just asking, for your cooperation so that we can all make this a successful vaccination site and program. I really think my main takeaways, remember 65 and older, appointment or only, don't show up too early. And, I just want to thank the community. I really want to thank Annette and all the partners. We're really a lucky county. We've gotten more vaccine out than a whole lot of counties based on our population, and we're here to make that even better and to amplify what's already been happening. And together and with your cooperation, with following, the schedules and all of that, we are going to get this out to you as quickly as we possibly can, I promise. I hope y'all have a great afternoon, and I think it's my turn to introduce Judge Barbara Canales.
Quiero repasar la logística, ya que es de vital importancia que todos sepan y comprendan cómo funcionará el proceso para nuestro megasitio de vacunación. Este estará disponible solo para la población de más de 65 años y solamente con cita. Se le pide no acudir si no cuenta con una cita, ya que será rechazado. Para poder hacer una cita puede dirigirse a la página web a la dirección driscollchildrens.org/COVID-19 vaccine y nuestras redes sociales para saber cuándo tendremos la próxima vacuna. Esta semana contamos con 1,000 vacunas. Una vez que hayamos recibido las vacunas, activaremos el sitio web. Si no cuenta con una computadora, puede también llamar al número 1-844-977-1477, de lunes a viernes de 8 a 5. No sabemos qué medicinas o qué vacunas vamos a recibir, pero esta semana contamos con la vacuna de la compañía Pfizer. Nuestras clínicas del sitio mega de vacunación se llevarán a cabo en el American Bank Center. Se le pide ingresar por la entrada de la bahía, ahí habrá estacionamiento. Se le pide también no llegar más de 30 minutos antes de su cita programada o también será rechazado. Ahora los comentarios de la juez Bárbara Canales.
Gracias, Gaby. Barbara Canales, Nueces County Judge. Good afternoon, everybody. Well, today is Groundhog Day. And over the course of this pandemic, sometimes I feel like I'm inside the movie Groundhog Day, where every day you wake up and you play the same scene over and over. Sometimes you get better at it, and then sometimes you find yourself back trying to perfect that which you started so many months ago. I find myself in Groundhog Day because we say as many times as possible, wear your mask, wash your hands, watch your social distance. And today, because it is Groundhog Day, I want to repeat things that I believe are important. And they are exact words that we drew from a press conference right here last spring. But I do believe that it's not only a good quote, but I think more importantly, I love when I see it demonstrated in real life. And so it's a quote that I had the pleasure of sharing, I think, the stage with these very same doctors, only there were lots of us. Do you remember? We were up there. I think we even got into trouble because we were too close. Henry Ford said, "Coming together is the beginning. Keeping together is progress, and working together is a success." My friends, today we are working together. This is exactly how we are going to make these two words really mean something in our community. And I want you to get comfortable with these two words, because not only will you hear me say it over and over, but I truly believe it is the only way through, and that is health equity. Today, we bring opportunities, we bring options, and we bring health equity with this amazing partnership. And we're grateful, so grateful for Driscoll Children's Hospital and their leadership that have spoken here this afternoon. It doesn't surprise me, by the way, at all, that these are the professionals that join us here. They are so good to work with, and we have seen them in action. And because almost to the day, 15 years ago, your hospital saved my daughter's life, it is absolutely fitting that I am here with you as we embark in a journey that will continue to save lives with every vaccine that you place into people's arms. In our fight against the coronavirus and this terrible, terrible illness that it causes, COVID-19, our neighbors who work on the front lines of medical care have constantly shown their caring and compassion, and they've also demonstrated their skill and determination spirit. But Dr. Peterson, you kind of blew me away. I didn't realize you all were logistics champs as well. So this very interesting new option that allows for appointment bifurcated, both by telephone and by online, is really the way of our future. And we know that, and we've always known that. And now that we have more vaccine coming to our community, it will be, I think, important for us to give more options so that we will have the opportunity, quite frankly, to see our loved ones get the vaccine in the best way for them. If they're highly mobile, they're going to basically want to make an appointment and get down. If it's easier for them to be with a loved one, then maybe the fairgrounds is the right place. There's going to be these different types of scenarios as we play a role all together. We need to make certain that we're all part of this team and that the team is effective when we do work together. So for me, the best teams are the ones with strong leaders. Leaders set goals, leaders define mission, leaders get their team focused, and they understand the most important challenges of the day. And so I know, Eric and Dr. Peterson, that you are blessed with an amazing team that you will bring with you at American Bank Center. And in taking on this challenge to help get many of us, particularly those of us that have vulnerable people in our families, vaccinated as soon as possible, you're bringing this trained and qualified personnel needed to do this job efficiently as possible. And while you remarked that you have requested 2,000 and we've only received 1,000, let me remind you of our roles as electeds. Both the mayor and myself will do everything we can to push up and advocate for that full 2,000 allocation, because we know that it's better to do 2,000 than 1,000, and we know that you're staffed and ready and prepared to do so. So, coming together is our beginning, keeping together is progress, and working together is a success. And so again, thank you, Driscoll, for all that you have done and for all that you are committed to doing. It must be good karma, this room, with all of us together. It wasn't but a few weeks ago when I answered the phone right before a press briefing, whispered to Annette that it was you on the telephone. When you said, "Can we use American Bank Center?" I said, "I will find out right now." And I passed the phone to Peter Zanoni. While the mayor was speaking, it was her first day. She had been inaugurated, taken the oath of office that day, and on that day, she made plans to get American Bank Center secured. That is what it means to be able to have effective leadership in the room. So, what can I say? This is the kind of success that we want to have. It will be the success that brings us broad immunity to our community. It will allow us to beat COVID-19, and it will get us back to living our lives normally. You said it yourself. Every day that we vaccine is one day closer to ending this pandemic. And so I look forward on this Groundhog Day to breaking the cycle of Groundhog Day. But until then, please, as you'll see me do, wear this mask. Watch your social distance. Wash your hands. Even if you've had the vaccine, until you've had that second vaccine and a sufficient time has passed, continue to do all the practices that will keep us safe together. And again, sometimes people ask me, was it a good day today, Judge? And I'm always hesitant, because this morning I started my day comforting a woman who lost her brother who was 52 years old. One day he was fine. 2 days later he was in the hospital. 4 days later he was gone. How could it possibly be a good day, I say to myself. And then I go to the American Bank Center, and you'll hear more in our next press briefing, and I see the marvel of people coming together. 4 hours later, not only are we done, cleaned up, and having vaccinated 500 individuals, we come and make an announcement that 1,000 more this very week will be vaccinated. We anxiously await our allocation for week 9, and I can tell you that it is a good day in Nueces County. Thank you so much.
El día de hoy es el día de la marmota y así me siento, que todo se repite una y otra vez. Y yo quiero repetir lo que es importante. Me da mucho gusto trabajar con el sistema de salud Driscoll. No me sorprende que sea tan bueno trabajar con estos profesionales. Los hemos visto en acción en nuestra lucha contra el coronavirus y la horrible enfermedad que causa. Nuestros vecinos que trabajan en la primera línea de la atención médica han demostrado su cariño y su compasión, también su habilidad, su determinación y su espíritu. Ahora contamos con 2 opciones para realizar citas, ya sea por internet o por teléfono, y esa es la manera de trabajar en el futuro. Driscoll tiene la suerte de contar con líderes increíbles y nosotros tenemos la bendición de tener a Driscoll en nuestra comunidad. El sistema de salud Driscoll pidió 2,000 vacunas, pero solo recibió 1,000. Nosotros haremos lo posible por seguir recibiendo más vacunas para nuestra comunidad. Driscoll pidió utilizar el American Bank Center para llevar a cabo ahí su sitio de vacunación y gracias al trabajo en equipo se logró obtener ese sitio. Gracias Driscoll por todo lo que ha hecho y por todo lo que se ha comprometido a hacer. Nos hemos unido, nos hemos mantenido juntos y estamos trabajando juntos. Recuerde tomar todas sus precauciones para mantenerse seguro. Lave sus manos, use un cubrebocas y guarde su distancia.
Thank you, Gabby. At this time, we will have Dr. Peterson come up for any questions.
Does anybody have any questions?
Comments? You may have covered everything. Oh, he's got one.
Will people who are arriving for a vaccine be able to walk in, or do they have to drive in?
So, no, it's not a drive-through. So it's a walk-in with an appointment, all right? And so it'll be on that main entrance on the bay side. And we have it set up similar to how we've been doing the vaccinations in our auditorium at the hospital. It's a pretty efficient process. And we'll have people, you know, guiding people to the right doors and assisting if people need a wheelchair. We'll have all of that ready. But it is a walk. It's not a drive-through. So, you know, we've got a room for people that need to wait the 30 minutes. Normally, if somebody's had like an allergic reaction to anything really, major allergic reaction, if they carry an EpiPen with them, then they need to wait 30 minutes. We have a room designated for that. And then we have a beautiful, beautiful bayfront view for all those that are waiting their 15 minutes to make sure everybody's safe and good to go. And then we'll get them their second appointment for their second vaccine before they leave, and good to go. You know, I'm hopeful, ever hopeful. I shouldn't raise too many expectations, I get, but if we can get an efficient process going, most people really, you know, I think the first time around it may not happen, but hopefully it can be efficient enough, like at our hospital, people are in and out within 30 minutes, so it should be pretty quick. But that's only if we get the cooperation of not a whole lot of people showing up before their appointment times. The police are going to be out there, and they're going to be, you know, checking. We'll be checking that you have an appointment before you go in. So just people know that we are checking.
And one more time, can you talk about where people should park?
So there'll be police out there directing traffic, but if you go on the ocean entrance side of the American Bank Center, and there will be for handicap, there'll be parking along the curb, but you know, for people that can walk a little distance, there will be all the barge dock parking will be cleared out. That's just right across from the American Bank Center. And then we've got some overflow parking lots as well that traffic control will direct those individuals to.
What are some of the ways that you're going to be verifying that they have an appointment rather than people just saying, oh, I made an appointment?
I've got a computer screen that has all the appointments listed. I have a printout that has all the appointments listed. So it's there in black and white. It's a very easy process that we've set up. Congratulations to our IT team that was able to do this with our Epic software. And, you know, I'd love to hear feedback from people, but, you know, it should be very easy to register. For people, we're really only asking for the information required by the state of Texas, okay? And so those are things like your full legal name, your date of birth, your address, you know, contact information, that kind of thing. And that goes into what's called the MTRAC registry. And so that information we're required to send to the state of Texas and the MTRAC registry in order to be a vaccine hub and to give out the COVID vaccine. So we're really requiring very limited information. It really shouldn't take long to fill out really your contact information, and then you have the appointment time there. Once again, we don't want people showing up too early, so please no more than 30 minutes. You know, hopefully that way you won't have to wait that long, and it'll work for everyone. Well, I ask for everybody's patience as we do our first one. We've been through several walkthroughs, but you never know until you do it. But I can promise you this, that every time we do one of these, we debrief afterwards, and we improve the process every single time. So it will get better and better. I'm confident of that.
Thank you, Dr. Peterson, and that will conclude our briefing for this afternoon.